GOP is trying again to cut Medicaid. Republicans again have their eyes on Medicaid for those with low incomes or disabilities. A GOP proposal unveiled this week would require many enrollees to prove they're working, volunteering, or studying, and it would also cause them to shoulder more of the cost of their care. Changes are needed, conservative lawmakers say, because the program is broken and costs too much. Medicaid's annual price tag has soared from $590 billion to $900 billion today. Yeah, why has it soared? It has soared because you know who still gets paid? The health insurance companies, the healthcare companies, the big pharma. Like the U.S. government is paying those crazy prices when they pay for Medicaid,
which have gone
up for these medications that in other countries cost 1/10, sometimes 1/100th of the price.
Also, I'd like to point out that it's probably more now, but like 10, 15 years ago, 1 out of every $3 spent on healthcare, and that includes Medicaid, Medicare, whatever, is spent on admin. Because like your thing says, like there are 24,000 like options for, I mean, that's dumb. What if we all just had healthcare from the moment we're born to the moment you croak, and that's it? Yeah. There's no this plan, that plan would choose then guess what? You get rid of all of the bullshit admin, and you just like those people can get jobs doing shit that is way more useful to society than telling people they can't have healthcare.
Yeah, people seem they're confused on this because Republicans, plenty of Democrats as well, want them to be confused on this. They go, "Oh, Medicaid or Medicare is costing the government so much. We don't have that kind of money." And let's ignore the fact that we do fuck that kind of money. Okay, we've got $1 trillion for the military every year, but ignore that. The reason it costs a lot is because of this insane system we have. There are countries that are 1 million times poorer than the United States that somehow can pay for healthcare for all their citizens. How do you think that is? Do you think it's because they just came across $900 billion? No, it's because what the government is paying is in a system that is meant to enrich a tiny number of assholes. So if you got rid of that system, and like you said, all the bureaucracy, all the middlemen, mainly men, all the middle people.
Middle people doesn't sound
Yeah, it sounds like you're almost insulting little people. No, all the middle people, then it wouldn't cost nearly what it does. Like that's how you fix it. You get rid of the whole thing. And back when there were some efforts, Obamacare and stuff, to change things, people ran around going, we can't just have free healthcare. It's 1/6 of our economy. It shouldn't be. And sorry, our economy will take a hit so that everyone can have free healthcare.
It actually wouldn't.
I know. What in their system it would, but yeah.
What do you mean their system? We have the same system.
No, I mean you'd have a bunch of rich people not getting as rich.
Well, yes, that. But actually, like universal healthcare would cost less money.
Yeah, kind of like housing everybody who's chronically homeless would actually cost less money than leaving them homeless because of all the city costs of dealing with homeless. Yeah.
Again, this was like 15 years ago. 1 out of every $3 on admin, you would need that. That's trillions of dollars over the course of 10, 15 years.
The sponsor for this video is Chapter, a free Medicare navigation and advice service. So if you're 65 or older, or your parents are, Chapter can really help you understand the 24,000 plans. Yes, there's 24,000 with Medicare, Medicare Advantage, and Medigap. 96% of people who use Chapter return to use it the next year. Seniors have historically saved over $1,000 a year using Chapter. Also, Chapter has a near perfect reviews online by those who have used it, and it's got an A+ with the Better Business Bureau, and it's free. So check out if Chapter's right for you or your parents. You can either go to askchapter.org/camp, my last name, or call 757-349-8232. All this info will also be in the description of this video. And did I mention it's free? But yes, they're going at Medicare. Let's see if I read all the part. There's a little more here. In the past 8 years, Medicaid enrollment has surged to record highs. Good. People should be getting free healthcare.
Well, it also speaks to the fact that the economy is crashing and people don't have other options. Yeah. Because it's not like you can just get Medicaid. You have to prove that you're Medicaid eligible, which is dumb. That actually speaks to the fact that more and more people are living in poverty and need Medicaid to get basic healthcare. Yeah, more people in poverty, absolutely.
with the COVID-19 driving numbers up and 9 more states expanding the program to cover more low-income Americans. Oh, the tragedy, including 6 controlled by Republicans. More enrollees, particularly in red states, means more constituents who rely on Medicaid to cover their health costs, making it harder for lawmakers to approve cuts. So basically, red states are now have a lot more people on Medicaid. All of a sudden, they kind of don't want to cut it as much. More than 3/4 of the public opposes major cuts to Medicaid. This
Doesn't matter.
Yeah, this is like hugely popular. I mean, yes, free healthcare entirely would be more popular, but I'm just saying in our broken system, Medicaid is hugely popular. 75% of the country says it should exist, and that includes 55% of Republicans. But these rich oligarchs who rule our Congress and rule our Oval Office, they want to cut it so that they can give themselves tax cuts and shift the money around that way.
Timothy made a good point. If you have health care through your employer, wages are so low that most people can't afford the copays for anything halfway serious. That's also a really good point. And something that I experienced when I had health care through my employer in Los Angeles, I couldn't pay for the copays anyway. So it was like I basically didn't have health care. And so I think that's a really important point, that there's like the barriers to accessing Medicaid. It's like, oh, well, you're not poor enough. Well, I'm sorry, what's poor enough? Because if I have anything even remotely serious, even actually like even a lot of preventative healthcare, there are some screenings that are done for things like cervical cancer and things like that cost more money than just a regular pap smear. If they have to like go and see you again for something where they have to go in there and dig a little bit deeper, that is a different, that's not just like your regular pap smear. And so that requires more money. Well, what are you going to do if you don't have that money? I guess you'll just have cervical cancer. I mean, it's because you're not poor enough to access Medicaid. Yeah. I'm preaching the choir. And everybody who lives in this country knows if you're not from this country and you're listening, yes, it's this bad.
And similarly, there are people on Medicaid who are really close to the line of how much they're allowed to make, and they won't take other jobs that they could get, like especially the freelancers or something. No, because then if I get past this line, then I can't get my Medicaid, and then I'm disabled, what have you. I would be completely screwed if I didn't get Medicaid, so I can't work anymore.
It's the same thing with housing vouchers.
How insane is that?
A lot of people get housing vouchers because they can't afford housing, but then if they make enough money to like afford food, they'll lose their housing voucher. So it's like, okay, do I want shelter or do I want to eat? Yeah. It's like these are legitimate decisions that people have to make and that people do make on a regular basis, especially people with children.